Czech Republic, Czechoslovakia, and then we escaped to the United States. Down the road, my mother and parents took me to get away from that socialist type of environment with a government-run single-payer system. I had a couple of personal experiences with this government-run single-payer system. When I was 8 years old, I needed to have my adenoids out, which is sort of like the tonsils up in the nose. And so we scheduled the surgery, and my mother took me to the hospital and went to the operating room. And they laid me down on the table, and I don't know how much you remember as a child when you were 8 years old. I don't remember many things, but I remember this very vividly because they laid me down on the table, and they took my tonsils out without any anesthesia. And I still remember that very vividly, every detail of that experience. Now, the reason for that was because that was not considered necessary, or maybe it was not in the budget. And this is my big fear, that when you get into government-run healthcare, bureaucrats will decide what is necessary, not the doctor and patient speaking together. I have one other anecdote, one other experience I had, which had more serious consequences than just remembering that experience, is that my uncle, who was an attorney, developed kidney failure at age 52, which is my age, so I'm 53 right now. So he developed kidney failure, and 9 months later, he died from kidney failure because he was not eligible to receive dialysis, because dialysis was only provided for people under age 50 at the time. So to me, that is what government-run healthcare can lead to. In fact, in the Czech Republic, since the socialists have left in the Velvet Revolution, they have now privatizing the healthcare system in order to eliminate these kinds of bureaucratic excesses that can occur. And if you kind of say, well, that's crazy, that's never going to happen here because that's over there, that was the communist type of stuff. Well, in fact, for me to take care of it, I do specialized skin cancer surgery called Mohs surgery for skin cancer removal. And it's got a 99% cure rate. It's the best possible cure rate you can get. But in fact, Medicare currently determines which skin cancers I can use it for and which ones I cannot use it for. So it is already, the government already is determining those kinds of things. And the thing is, with the government, I can't really argue with them. That's what they say, this is their policy, and that's how it goes. We've had an issue here not that long ago where a couple of insurance companies thought that they might save money by not allowing intravenous sedation for colonoscopies, which of course ultimately save some lives, and of course detecting cancer early is important. And they thought, well, you don't really need that, maybe a little bit of oral, maybe a little bit of Valium, and that's all you need. And having undergone colonoscopy, I'm very glad that I did not have to do that. And we were able to, as physicians, and with our patients, basically fight that, and the companies rescinded it. Because it's not a monopoly, we were able to put pressure. With the government, we're not able to do that. So I would strongly encourage you to support any efforts, including Senator Cunningham's effort to just protect the citizens of Missouri from government overreach with this government-run healthcare system. Thank you.
Czechoslovakia, is 80 years old, lives here now, and recently she called him and said.
Okay, yeah, I forgot my class. She's a Holocaust survivor, and so she brought us to this country. She's 85 now, and she called me up somewhat quite distraught when the first healthcare bill came out and said, so we brought you from Czech Republic to this land of opportunity and sort of freedom. And now they're going to be doing this same stuff that they did over there. So where do we go now? There's no place to go. So now I hope that with the success of these efforts on state level,